Dr. Lavanya Arivandi. I'm Chief Medical Officer of Ekin Care. Um, Today, we are going to talk about COVID-19 infection. What is relevant for today's scenario? There is a lot that's been happening from middle of January. Though the infection started sometime in December, we started paying attention in January, and after that, COVID-19 infection. Initially, it was called novel coronavirus. Now it's called COVID-19 or SARS-CoV-2, but we are calling it COVID-19 infection, not to get confused between SARS and this infection. A lot has happened, but what is relevant for today? Now, we will cover very briefly about the basics just to brush our memory, and then we will focus mostly on what is relevant for today, that is the scenario that people are going back to office, the lockdown is partially being lifted, domestic flights are resuming, and a lot of people are working from home, psychological issues, and lot of things. So, as you all know, COVID-19 or coronavirus is not new to humankind. There are different kinds of coronaviruses. There are already four kinds of coronaviruses that were causing common cold. And human bodies, we are not new to this coronavirus. But the current coronavirus is a different, new kind of virus, though it belongs to coronavirus family. The uniqueness about this particular coronavirus, if we have to say in one word, it spreads fast. From one person to another person, it spreads fast. If one person is infected, we call it R naught. R naught is a number. If one person is infected, how many other people can he or she infect? We call that number R naught. R naught is significantly high for COVID-19 infection, especially if social distancing and masks and all these preventive measures are not followed, which we'll discuss a little later. So that is uniqueness about COVID-19 infection, because we have seen SARS infection, we have seen MERS infection, but the spread was not this much. In fact, the death toll was much higher in SARS and MERS infection, Middle East respiratory syndrome and severe acute respiratory syndrome earlier. Those two, the deaths were much higher. The good news is for COVID-19, the death toll, that is the percentage of people who succumb to this in the total number of people that are infected. For COVID-19, this number is actually low. But because of its infectivity, the way it spreads very fast, this is unique. And we all know that World Health Organization has declared COVID-19 as a pandemic, and it is now spread all over the globe. As we speak, we have more than 5.5 million cases across the globe. In India, we have more than 130,000 cases, and in the last few days, the numbers have been increasing. Now, we have been through lockdowns, and we know a lot about symptoms and preventive measures now, but we'll quickly brush up the symptoms of coronavirus, who might get severe infection, who needs to be careful, and all those facts. Coronavirus can infect anyone. No one is particularly more susceptible, or some people are not less susceptible. It doesn't show any partiality. If you take the general public, the only thing that maybe we can say, people who do follow preventive measures, they do get infected less. But as per the protoplasm, as per humankind, if we all behave the same way, we all are equally susceptible. But that said, we keep saying vulnerable groups. Why is that? So, the vulnerable groups are those people who have the same kind of risk for getting infection. But if they get infection, they're more likely to get sicker, they are more likely to get severe symptoms, they are more likely to get admitted to hospital, getting into intensive care units, getting onto ventilators, and dying. That's why we call them vulnerable groups. Though their risk of getting infection is same, they do get severe infections. Now, what are these vulnerable groups, or who are these vulnerable populations? People who have diabetes, especially people who have uncontrolled diabetes, people who are elderly, the age above 65, they are more likely to get severe infections naturally, because their immunity is probably lower, their lung capacities are just because of the age, they're slightly lower, and the heart is probably not as stronger as in young folks for various reasons. Elderly people, people who have heart conditions, had previous heart attacks, have current heart disease, heart failures, these are the people that are at higher risk. Again, people who have lung problems from before, like asthma or COPD, we call it smoker's disease, or any kind of lung compromising conditions, these people are also at increased risk for getting severe infection. So these are some of the vulnerable groups. Similarly, people who have uncontrolled hypertension, they are at higher risk of getting more complications. This is proven again and again. If you have uncontrolled high blood pressure, it is time to really work on it and get it under control. Now, the whole point of lockdown was to actually stop the spread of infection so that the hospital systems, the healthcare systems are not overloaded with a sudden surge of inpatients, lack of beds, lack of ventilators, lack of hospital beds and ICU beds, lack of quarantine facilities. All that would have put us in a very, very grave situation like we are seeing in some other countries. We could escape from that kind of bad scenarios thanks to the lockdown and decisions taken by the government. Now, that said, now the lockdown is being lifted. So, we have a responsibility to save the lives of these vulnerable groups. And because it spreads so fast, you may think that you are not the vulnerable person. You are young, you are healthy, you're 20 to 30 years of age, you don't have diabetes, hypertension, lung condition. But if you come across elderly parents, grandparents, colleagues, neighbors, then you will be spreading infection to them. So, even for young folks of all ages, it is our responsibility to follow preventive measures. Now, let's touch upon symptoms a little bit before we go to preventive measures and talk more about what to do in current scenario. The symptoms are usually sore throat, fever. These are the commonest symptoms, and feeling very tired, body aches is one more unique and common. It's not unique; it's a common symptom for COVID-19 infection. So when you say the sore throat, fever, body pains, and feeling tired, it sounds very much like influenza, flu, right? I mean, yes, COVID-19 symptoms and flu symptoms are very difficult to differentiate from each other. Now, what are other symptoms of COVID infection? Sometimes you may get respiratory compromise, that is shortness of breath. Sometimes gastrointestinal symptoms, diarrhea, stomach pain, and sometimes nausea, vomiting. And you may get a symptom of loss of taste and loss of smell. Some people have noticed that. If you observe keenly, some of the people might notice this. Another symptom is red eyes, conjunctivitis kind of symptoms, because COVID does infect the mucous membranes, eye, oral cavity, nasal cavity, and all the mucous membranes. So, eye infection, that is conjunctivitis, is also one of the symptoms. You can get shortness of breath, we covered. Sometimes, when you get these symptoms, you may have low oxygenation. You may be sitting fine, you may be not feeling anything, but it is noticed that some people can have low oxygenation. So if you anybody in your family, friends, anyone, unfortunately, if they turn positive to COVID-19 infection, it is extremely important to notice. And even if they develop slightest shortness of breath, you need to seek doctor's attention, because we call it happy hypoxias. Some people have hypoxia, but they are just sitting happy and talking. So, because of that, even the slightest hint of shortness of breath or respiratory compromise or chest pain or dizziness, these symptoms one should never ignore, and they should always seek medical help in these COVID positive patients. And elderly, of course, even milder symptoms, it is better to consult a doctor. Now, how do we prevent? We did say that mostly COVID-19 infection spreads through mucous membranes, that is nasal mucous membranes, oral mucous membranes, and mucous membranes of the eye. And we all have a habit of touching the face and touching surfaces. We touch the surfaces all the time, and we keep touching our face, eyes in between. So, if someone is infected, they may be touching their secretions, and they are touching the surfaces, doorknobs, and elevator buttons, light switches, and all that. And the virus gets deposited there, and another healthy person comes and touches it. Person who doesn't have infection, he can contact COVID-19 infection from those surfaces. So that is one major mode of spread. Even more common thing is when a person coughs or sneezes, we do emit respiratory droplets. When we're coughing, even talking, we may not see those droplets. Those are micro droplets. They do emit from our mouth, and they are deposited onto the surfaces. So one way that we can prevent is by wearing mask all the time. If we step out of the house, we can avoid the emission of these respiratory droplets. And not only that, it will also help us avoid touching the face because the nose and mouth are covered with the mask. But more importantly, by wearing the mask, the droplets are not emitted from one person to another person. So, in the very early days of COVID-19 infection, we used to say only sick people need to wear the mask. But currently, because of the spread and because of more number of people having infection, now everybody, whether you are having any symptoms, whether you are sick or not, if you step out of the house, you have to wear the mask. What does it do? Even if you are healthy, if you come across to another person who might be infected, your mask and their mask, they are giving you double protection. So it's kind of like a double protection. So if you're going out of the house, please do wear a mask. Now there are government rules also strictly mandating that everyone wear a mask. Now we said we often touch face and surfaces, and that's how it spreads by contact of the surfaces. So one big weapon that we have in our hand to tackle this is hand washing. Thorough hand washing, frequent hand washing. Now, hand washing has a certain way that we need to do. There are some videos, good videos on internet. You may want to watch them. Usually in medical schools, doctors are taught this, and in nursing schools, nurses are taught this so that we don't spread infection from one person to another person. So you need to spend at least 20 seconds washing, and there is a method to wash, like palm on the top and washing between the fingers and washing around the wrists and near the nails and knuckles. So these areas should be specially paid attention to so that all the areas on the hand are covered and the virus is washed off. Now, we said wearing a mask, and we said frequent hand washing. Another measure that we need to make sure that we follow is social distancing. Even if we do all this, there are chances that when you sit very close, you're touching each other. It's not always just the hands that might harbor infection, right? If you're sick, I mean, you're coughing on your own clothes, onto your own clothes, and your other parts of the body may be having virus deposited on it. So unnecessary touching, shaking hands, and sitting too close, and coming in contact less than 6 feet, these all increase the risk of spread of virus from unhealthy person, infected person to non-infected person. So social distancing is one important measure. If you go to a store, if you go to any place, please make sure you maintain some distance. Even if others are not following you, maybe it is your time to take social responsibility and make sure everybody follows a queue and keeps at least 3 feet of distance between two people. Now, one more thing is avoid public transport as much as you can. Currently, the government is actually running buses, and they are thoroughly sanitizing the buses inside the seats and where all we touch the commonly touched surfaces. But if you can avoid public transport, in case you cannot avoid it, and if you are having to take, there are designated seats. They are taking care so that people don't sit next to each other. Follow the rules, And as soon as you get off the bus or train, first thing you need to do is sanitize your hands. Have a small sanitizer in your pocket. Sanitize your hands because you would have touched the railings, you would have touched when you're getting down the rods and all that for support. So sanitize the hands immediately, then you're good to go. Now, if you're sick, even if you're slightly sick, do not come out of the house. Do not go to your office. Currently, employers are also very aware of this situation, and they are very understanding and do not hesitate to take a sick leave or ask to stay at home and work, because even if you're mildly sick, there is a chance that you will go to office and spread the infection to other people. And the same rule applies to going to stores and unnecessarily going and shopping around and all that. If you're sick, please maintain social distancing and stay at home, isolate yourself, and protect others as your responsibility. And the same rule applies to your family members. If you're sick, confine yourself to one room. Preferably, if the room has, if you have the facility to have a bedroom with an attached bathroom, that would be the best, so that you don't go in and out of the room. And tell your family members to give you food. Rinse your own plates and hand them to them. And they need to wear gloves whenever they are taking your fomites for washing. They need to wear mask. You need to wear mask even inside the house if you're sick. And you clean your surfaces with, it is better that you help in cleaning your room and your bathroom and all that, so that other people don't come again and again into your room. This is one way of protecting your family members in case if you're sick. Now, a lot of people have a worry that a sickness may be COVID-19. Currently, there may be a lot of common colds are happening, and at this time, usually the flu also starts. And your sickness could be any of caused by any of those. So there are certain guidelines released by the government so that the doctors can follow those guidelines and order the testing. One is clinical judgment. They will listen to you. They do assess your symptoms, but after they assess the symptoms, they usually follow these guidelines to decide whether you need a COVID-19 testing or not. These are issued by ICMR under the guidance of the government. So healthcare workers are required to follow these guidelines strictly. So what are those, who are those people that usually are required to get it tested in case if you have symptoms, and sometimes even if you don't have symptoms? So the few people are people who are healthcare workers, doctors, nurses, who are frontline workers, who are coming in contact with sick people. Uh, the other people are if you came in contact with a COVID positive person, your cousin, your family member, your relative who visited you very briefly, came back as a COVID positive. Okay, the test turned positive. If you met him in the last 14 days or in the last 10 days, you come as positive contact. Meeting means sitting in the same room at a reasonably close distance and spending few minutes. Not just working in the same office in a different floor. That doesn't come under close contact. Close contact is coming in reasonably closer distance, spending some time with them. So if you are a close contact between day 5 and day 10 of your contact, after the person turns positive, the doctor will check how many days it's been that you came in contact with the person, and if it is falling within the required time, the doctor will order you a test between day 5 and day 10. Okay. And if you've had an international travel, of course, you will get tested. Now, international travel is not relevant anymore since the flights are not going in and out of the country. Now, any person who lives in a containment zone or red hotspot areas, red zones, if you're living in a red zone or hotspot area, and if you're having symptoms, you will definitely get tested. Okay, because your area is designated as a hotspot area. That means there are more number of cases. So if you have symptoms, please do contact the doctor, and the doctor will order the test. Now, what is this test and how is it done? The test is called RT-PCR, reverse transcriptase polymerase chain reaction. It is done by a health worker while he or she is wearing the personal protective equipment. You will have to go to a designated lab. The government has given clear guidelines which labs are doing this. As of now, each state is slightly different in terms of protocols and the kind of labs that tests are being, given to. But please don't go without calling. Call before going so that you avoid running around from one lab to another lab or one facility to another facility. And always call government helpline number. When you go there, the person who is wearing personal protective equipment will take a swab from back of your nose and back of your throat. We call it nasopharyngeal swab. He takes that swab, he takes your signatures that you are agreeing for this test, and he verifies some details like your Aadhaar number and things like that. And he makes sure he has a number of the hospital or a doctor that is ordering the test. And once he collects the specimen, you're good to go home if you're not having severe symptoms. The test usually comes back within 24 hours. They do call you with the test results. If you're turned positive, in case if you have milder symptoms, many states they are allowing you to stay home. If you have milder symptoms, you can stay home, but you have to isolate yourself and follow all the precautions that health workers tell you to follow. But if you have moderate symptoms or severe symptoms, you will immediately get admitted to the hospital. So this is the usual routine that happens if you have any symptoms, and if you live in a hotspot area, or if you're eligible for testing, you come in contact with any COVID positive person. This is what usually happens. Even when you are at home under isolation, you will be contacted regularly to see how you're doing. Just because you're doing fine now doesn't mean that by evening you will be continuing to do the same. So you need to really pay attention to your health, be very sensitive to the changes that are happening, and if you have any doubt, call the healthcare workers. Now offices are open and many of you are going back to offices. Now what do? Lot of corporate offices, they are taking reasonable precautions. They are marking designated spaces. They are leaving one space between two chairs. Or if it's an open office, they're making sure that there is at least 6 feet distance. So please do follow those rules. Don't change your seats often. Do take your water bottle and coffee mug with you. Do not share utensils. And even in cafeteria or lunch room, please go in batches, and instead of sitting too closely while eating, it is better to maintain some distance and have your lunch breaks in a staggered manner. And when you go to office, if it's not really third floor or ninth floor, something like that, please do prefer taking stairs rather than taking elevator. If you have to take elevator, use an object like a pen tip or toothpick, something like that, to press the buttons. You can discard that once you get out. And usually the office doors and everything is kept open. Offices are cleaning all the surfaces with hypochlorite solution as per the requirements. From time to time, the offices need to close these surfaces wherever people are coming in contact with, like doorknobs, door handles, toilet flushes, light switches, all the table surfaces, and chair armrests where you keep your hands. All these things need to be thoroughly cleaned and frequently cleaned. Okay, so these are some of the precautions that you need to take while you're traveling and while you are at office. Now, many people are working from home, and it's not as easy as we think. Working from home requires a lot of discipline, and a lot of arrangement and lot of structure. If you don't have that structure, discipline, and proper arrangement, work from home can cause you a lot of stress. The fear that your employer may be thinking that you're not working, and the fear that people just your house members might barge in while you're on a video meeting, and not being able to time your breaks or having lunch or meal on time. These all can really pull you down, and you can get really depressed and have a low mood. Uh, because on top of it, you're not meeting many people. You're pretty much under quarantine. So I do want you to take some precautions Get up at a usual time that you would get up when you go to office. Get ready, get dressed. You anyway save commute time. You may want to use that commute time for something at your home, but sit at your desk at your usual time, and tell your family members about your breaks, your usual timings of the breaks, and please explain to them that they shouldn't be disturbing you other than the break times. And usually in offices, we do move from table to table, converse, and go for small tea breaks and all that. Even at home, please do take 5 minute breaks in between, stretch yourself, and walk around a little bit rather than not taking breaks. So do maintain that, and make sure your table and chair and laptop are properly faced. The screen should be at your eye level. The chair should have a nice back support. The feet should be touching the floor, not hanging or not too bent, and your neck should not be too forward, bending over onto computer. Now all of us are working with laptops. Please have something underneath the laptops to elevate the position. Most of us have a habit of looking down. That's not good for you. And adjust the brightness of the screen. Please do take all these measures. And another important aspect that is worth covering today when we talk about COVID infection is vitamin D and sunlight exposure. A small studies have shown that vitamin D deficiency is not good in this scenario. People who have vitamin D deficiency may not be doing well. And as you know, vitamin D is called sunshine vitamin. The one sure shot way of getting good vitamin D into our body is getting exposed to sunlight. Now, summaries here. Wake up on time and see the sun in the morning. Spend at least 30 to 40 minutes if you can, preferably in the morning, because in the morning, if you are exposed to sun around in summer, I will say around between 8:30 to 9:30, you will have added advantages. Not only are you getting vitamin D, your circadian rhythm, your clock, internal clock, is so well set or so much in sync with the cycle, you will have a very good sleep. In studies, it is shown that compared to evening light, if you're exposed to morning light, your sleep quality is much better. So you please spend some time in sun, tank up, and get that vitamin D into your body, and have good sleep. Uh, Now, these are some of the things that I would say you can do while you're working from home. Some other psychological aspects: call people, your friends, relatives, your cousins, your mom, dad, whoever is not staying in the same city or same home. Keep in touch with them. Preferably do video calls. Now it has become a culture, even in families, to do a lot of Zoom family meetings. All these things to elevate the mood little bit, so that we don't feel lonely, and so we don't feel that we are tackling this infection all alone, because we are bound homebound and we are not meeting anyone in person. At least these virtual meetings will help us feel connected, even with your colleagues. Once in a while, have some video meetings and catch up. It doesn't need to take a lot of time. Just 15-30 minutes of quick catch up once in a while may do a lot of good. And over communicate when you're working from home to avoid a lot of misunderstandings. Now, one more question often people ask is, okay, you're saying there is no treatment, you're saying there is no vaccine. As you all know, vaccine is being developed, trials are still going on, and we all know that there is no treatment, there is only supportive treatment. That means when you join a hospital, doctor will check your BP, make sure it's okay, pulse is okay, oxygenation is okay. If your sugar is high, they will give medicines to control it. BP is high, they give medicine to control it. If your heart is going weak, they may give you medicines so that it can pump little more stronger, and things like that. But really, for COVID-19, to cure it, there is no treatment, and to prevent it, there is no vaccine. So that's why preventive measures are even more important. Now, when we are saying no treatment, no vaccine, Now we're all relying and banking upon the innate immunity that we have in our body. Now, now we are left with boosting up our immunity. Everybody is now asking a question: how do I boost my immunity so that even if I contract the infection, how do I fight with it with full power? So there are few things, time tested, age old, wisdom the that our elders from generations knew what would be good for our body. Now those revolve around diet, exercise or being physically active, sleeping well, being stress free or managing the stress well, and having some downtime so that you're not running around all the time, and social connections, being connected with the society, being connected with people. These are the things that will really boost your immunity. I will cover one by one very briefly because I think time doesn't permit for us to go into details of everything. But I think if you know general principles, that's enough because you can get a lot of information on the details. Let's focus on the big picture. Now that you're staying home and lot of takeouts are closed, please do maintain and don't get into the our old habit of ordering takeout food and eating lot of pizzas and oily fried chickens. So take little bit time to cook for yourself or for your family. Try to take homemade meal. Homemade meal is always best, hygienically prepared. If possible, eat fresh meal, fresh vegetables and salads. Salads, when I say that, only cooked salads. It is better not to take raw ones. Not, in fact, COVID-19 doesn't. There is not much evidence that it spreads through takeout food or through food. But in general, in summer, it is always good to have nicely prepared cooked meals. So you can make salads with these pulses and all that and eat. Take lot of vegetable portions, lot of fruit portions, pulses, and meat products. Egg white has lot of meat, and lot of pulses have good good protein. So high protein diet will help your body to form antibodies to fight the infection. So take food that is good in protein. Cut down on sugars. A little bit oil is okay, but added sugar in your food, if you cut down as much as you can, that would be really good and help you not gain too much weight. Not gain too much weight. Now, exercise. At least spend 30 minutes in a day doing some kind of exercise, whatever you were doing before, at least maintain that wavelength, that kind of intensity. If you're a kind of person who didn't exercise before, now is a good inspiration, now is a good opportunity for you to start. There are a lot of YouTube videos, lot of online sessions going on. Choose one that is good for beginners. Don't overdo it in the beginning so that you don't get muscle pains and cramps and muscle pulls, which will set your again entire routine by 10 days back. So start slow but be very consistent. Spend 30 minutes in a day for your exercise, and if you can, more is merrier. There is no limit for 30 minutes, but when it comes to exercise, something is better than nothing. So if you were not doing even 5 minutes, start with 5 minutes. Take 2 flights of stairs as your first step to exercise today, right now. Okay. Now, maintain your sleep timings and maintain sleep hygiene. When you go to bed, don't take things to your bed. Don't spend time with gadgets at least few minutes before going to bed, and have nice sleep evening routine so that 1 hour before sleep you do the same things every day, like whether it is taking shower, reading a book, whatever it is, you should have a set routine. Then your brain knows that it is time to sleep. And maintain nice hygiene, slightly colder temperature in the bedroom, and sleep well. Manage your stress well. There are a lot of help outside, psychology help. Please do make use of a lot of these good apps, technology driven apps that are really trying to help in COVID times and take care of your stress. Now, social connections. Like we covered before, try to be connected with people, try to think positive, remember good things, read positive books, watch some comedy shows or things like that, and always try to do something with people, even if it's virtually. So that will really have help you have a feeling of being connected and a feeling that there are a lot of people that are there to support you in hard times. These things will definitely boost the immunity, and these are tested ones. These are tested measures to boost your immunity. And good vitamin C is good, citrus fruits are good, and uh, uh, and just being consistent is more important. Doing a lot for 10 days and not doing anything for 10 days may not be very good. Just have a journal or diary and maintain consistency. So these are a few things for fighting COVID infection and prevention of COVID infection. Um, if there are any questions, I'd be happy to answer. I'll just cover a couple of interesting things and then maybe we can close the session. Um, now, what is herd immunity? A lot of people are talking about herd immunity. I just want to tell just a few words about herd immunity and how we can tackle this COVID infection in the long term, because now we know that COVID infection is not going to go away anywhere. Experts are saying that we are looking at the next 1 year at really dealing and living with COVID-19 virus. Now, anytime in the society when an infection like this comes, if people, let's say people don't follow any precautions, the natural course is people, many people will get infected. It spreads fast from people to one person to another person, and after reaching certain level, people develop antibodies. All these people who got infected and people who got exposed do develop antibodies. Now, when the infection this time, when it comes in contact with them, they do not spread anymore because they have antibodies and they do stop the spread right there with them. So when does it happen? Usually 70 to 80% of the society, 80% of the people in the society, once they are infected, if that many people are infected, then usually herd immunity is seen. Um, Sometimes 80 to 90% of people. Now, with COVID-19 infection, we cannot completely rely on herd immunity and not, follow any precautions, because by the time we achieve that kind of herd immunity, lot of lives will be lost. Lot of lives will be lost. Because of that, we are relying and we are hoping that we would get a vaccine. Vaccine is another way of tackling infections like this. There was a time that people were losing, a lot of lives were lost for smallpox. Now smallpox is eradicated thanks to vaccines. Similarly, measles, mumps, we know that we have vaccines for a lot of viruses now. So that is why it is important that we maintain good precautions until the vaccine comes out and a lot of people can get vaccinated. The lot of trials are going on. Um, Vaccine development has certain stages. First, they check in vitro, and then they inject the particles of the virus, or depending on the virus kind of virus, they select certain antigen and they inject into people, and they do see whether the people who got injected developed injected or swallowed. It depends on the road that you choose. Whether they developed antibodies or not. If they developed antibodies, then they check, is it enough to fight the infection. So is the volume of antibody, the titer of antibodies, is it enough to fight the infection? So only, and the final thing is it safe for the person? Is it safe for the person when we inject or when we give medicine like this, vaccine like this? So only if all these are tested, a vaccine is released into the market. So hopefully these trials will be successful and we do get a vaccine soon. A lot of medicines are also being tried. We have a question. Any special precautions you recommend for working medical sales representatives? Yes, I mean, it's a tough job. Medical sales representatives, you are completely relying on meeting people. Till now, I mean, a typical sales representative, the vision, the picture that we have is he always physically comes and meets and greets, and then we talk, right? I mean, at this time, probably you're really at increased risk. Suggest is because you're traveling a lot, try to use your own method of transport, whether it is your two-wheeler or two-wheeler is the best. If you can have that, have a two-wheeler, wear mask all the time, and when you go to meet your clients, do not shake hands. And when you I know you always have these catalogs that you want to show and you just explain with those catalogs. So do not hand those catalogs to the doctors or whoever is your client. Keep the catalog with you. You only show from a distance and maintain 6 feet distance when you're giving a presentation. And if possible, wherever, whichever office you go, better not to spend a lot of time. Take an appointment, go on time or 5 minutes before, and finish and take off, rather than going and waiting for their free time, because now everybody understands your problems. So please do take an appointment and try to give one-on-ones, or give a demo, or talk to small group, 2 3 people, rather than a big room full of people. Even they may not prefer that. So these are some of the things that I would recommend. So Vinayak, I hope we answered your question. Colonel Ashok Kumar, thank you. So one important topic I want to cover. A lot of people have asked me in the past about packages. We do get couriers. How do we handle, or groceries and all that? Milk packets. Simple rule of thumb: if you can leave it outside in your balcony or in your porch or your front door, near your front door, it doesn't get spoiled. Leave it out for 2 3 days. If it's not urgent and if it doesn't get spoiled, leave it out for 2 3 days. Nothing will happen. But what if milk packets we can't leave it out? Just bring them in, wash under running water thoroughly, touching the surface, cleaning the surfaces thoroughly. And once you empty, discard the milk packets directly into trash can and wash your hands thoroughly. And you anyway boil milk. We don't use milk without boiling in India. So that way we are good to consume that milk. So wash the milk packets thoroughly, discard the packets directly into trash can once you empty them, and wash your hands. Only then you touch anything else. Similarly, fruits and vegetables, we have a habit of washing them in salt water. Just wash them thoroughly by touching the surfaces and thoroughly rinsing them and scrubbing them with your hands. And then take them only after cooking thoroughly. Wash your hands before cooking, after cooking. And when you're dealing with 2 3 things, usually we have a habit of cooking meat on one side, vegetable on the other side. Even before COVID times, the general advice is use different cutting boards for raw meat, raw items, and different cutting board for vegetables. How to be safe in staying at lodges? Actually, it's a very good question. You may be traveling and you may be staying at the lodges. So um, what I suggest is carry your own blanket, pillow cover, or something to cover your pillow, and try to pay online. Don't touch anything like giving your credit cards to them at the front desk and things like that. Try to avoid. Do as much as possible do the online transaction. And when they give you the card to enter into your room, um, uh, sanitize it. Only then you use it. Uh, uh, my guess is the hotels now have spray to sanitize the card. Only then you touch it after they sanitize it. And while you have it with you, don't give it at the front desk. Keep it with you 2 3 days that you are using that hotel, or one day that you're using it hotel. Exchanging it all the time when you're going out, giving it the front desk and picking it back, it's not good. Mm, so try to keep the card with you until you check out. Even at checkout time, the paperwork, tell them to send an email. Don't take any paperwork from them. And try to, even at the front desk, try not to lean on to things and touch everything. And while you are in the room, the food should be ordered from a reliable place, reliable close by place. And always make something, always order something that you know will be hot. My simple rule of thumb is I order sambar rice and things like that, because I know they usually heat it. Even if it's not made fresh, they heat it so much that it is steaming hot. Whatever is there is dead when you do that. So don't order anything that will not be piping hot. So order that kind of food, even if it's simple food. And always carry fruits with you. Always carry fruits with you. Fruits like apples don't get spoiled, pomegranate don't get spoiled. Bananas, if you can. If you can, best fruit is banana, because you're not touching even the fruit. You don't even have to worry about somebody touching it and that going into your mouth. So always carry your fruits. And homemade snacks is good if you're traveling, so that you don't have to stop near dabas or roadside restaurants. Homemade snacks packed from home is good. How much safe is it to travel in cab or other transport? If you can, please use two-wheeler. If you can't, and your office colleague is close by, try to do carpool, because at least you know that only you three are there in that car. Whether she has the car or you have the car, you're not exposed to different people every single day. You're exposed to only one person or two people. Two, three people can make an arrangement and go in the car, split the charges or whatever. Because by that, you're not exposed to multiple people and your risk is significantly lower. And if you're really staying far away location, or if your job is okay to be done and you can be reasonably productive, please do discuss with your employer about work from home option. Now is the time they're a little bit more open, but I do understand a lot of professions they cannot work from home. And like doctors and nurses, I mean, very few people can work from home. So these two three during transport, and if you're taking a bus or cab, don't touch. Try to touch as little as possible the common areas, the handles. And sometimes it's unavoidable. As soon as you get down, take out the sanitizer from your pocket, sanitize your hands. Only then you get going. The first thing you get down from the cab is sanitize your hands. And do not remove mask at any time. Do not remove the mask at any time during the cab. And transaction with online payments is better. Do not transact with physical money. I hope you return to work safely too, and we all stay safe and tackle this infection well. Thank you, Archana, Ram Ganesh, and Vinayak. We'll close the session now. We'll wait for another minute and close the session. And by the way, a lot of videos are there on YouTube for good workouts, starting from beginner, mid level, and a lot of healthy recipes and short. Um, time-saving recipes. Uh, uh, there is a lot of stuff available online. Um, make use of those. Um, Usually, we don't spend that much time browsing and learning new stuff. And I hope all of you will, by the end of this lockdown, you would have done something new, something different to share your story with your kids, your families, your colleagues. Take care, you guys.